Welcome all. We all are familiar with the term royal. What do you mean by royal? The term royal means something related to queen, king or their families. In this lecture class, we can discuss about a royal disease. That is nothing but hemophilia. Why hemophilia is known as royal disease? Hemophilia, it's a higher number, it's present higher number in Queen Victoria's offsprings. So it is known as royal disease. Actually the hemophilia, the word that coming from two Greek old words, that hema and philia. Hema means blood and philia means affection or love. It's also known as bleeder's disease or other name is royal disease. By definition, it's a common hereditary coagulation disorder due to deficiency or reduced activity of clotting factor 8 or clotting factor 9. The hemophilia is one group of hereditary bleeding disorder or an X-linked recessive genetic pattern that causes abnormal or exaggerated bleeding and poor blood clotting and is characterized by deficiency of clotting factor. There are three types in case of hemophilia: hemophilia A, hemophilia B and hemophilia C. In hemophilia A is otherwise known as classic hemophilia. Classic hemophilia is due to the deficiency of factor 8. And hemophilia B, it's otherwise known as Christmas disease. Christmas disease, it's due to the deficiency of factor 9. Factor 9 otherwise known as Christmas factor, so it's called Christmas disease. And the third one is hemophilia C. Hemophilia C is due to the deficiency of factor 11. Let's discuss about the incidence of hemophilia. Based on hemophilia A, that's very common type of hemophilia, that's 1 in 5,000 male live birth. But in case of hemophilia B, that's a rare hemophilia and it's 1 in 10,000 to 30,000 male live birth. And based on severity, the hemophilia can be divided into three: mild, moderate and severe. This classification is based on level of clotting factor. In case of mild hemophilia, the clotting factor level is 6% to 49%. And in moderate hemophilia, the clotting factor level is 1 to 5%. And in case of severe hemophilia, the clotting factor level is less than 1%. This causes bleeding problems as early as the first days of life. But in case of mild hemophilia, it may be undiagnosed until adolescent age group or adulthood. Then etiology. We already discussed it's a X-linked recessive pattern. X-linked recessive inheritance is present in case of hemophilia. And also gene mutation. Gene mutation is also caused hemophilia. This is a picture that shows the X-linked recessive inheritance. Here you can see a carrier mother and unaffected father. And you just see the offsprings. There are two girl child and one is a carrier and other is normal. And two boys, one is affected and other is unaffected. And just look at the picture with the right side. Here the mother is unaffected and father is affected. And then what happened? The two daughters, they have carriers and the other two sons, they are normal. This is the X-linked recessive inheritance. Then we are considered the pathophysiology. Pathophysiological changes happens during the case of hemophilia. And in the mechanism of coagulation, the first when the cut injury occurs, then what happens? The blood vessel constrict to limit the blood flow. And the second occurs the circulating platelet that plug at the site of injury and they attract the other platelet and form a platelet plug. And this platelet plug formation that is known as primary hemostasis. And in case of secondary hemostasis, after that they activate the coagulation cascade. This coagulation cascade activation that ends in the secondary hemostasis. What happened in the coagulation cascade? This is a coagulation cascade, picture of coagulation cascade. In coagulation cascade, there are two pathways, intrinsic and extrinsic pathway. You can see the intrinsic and extrinsic pathway. There are 13 clotting factors. There are 13 clotting factors present in our blood, and these all clotting factors are inactive form. They are inactive form. When the coagulation cascade are initiated, then all are converted into the active form. You can just look the picture. Here the intrinsic system and the extrinsic system. This extrinsic system is activated by the tissue factor. This tissue factor by the tissue factor. Tissue factor happens after the tiny injury of the endothelium of blood vessels. Then what happened? Along with the tissue factor, our clotting factor 7 that converting to the activated 7A. That is the active clotting factor. Then that convert the clotting factor 10 into the clotting factor 10A. 10A is the activated form, and along with the cofactor 5, this convert the prothrombin to thrombin. The prothrombin actually the clotting factor 2 and thrombin is clotting factor 2A. And then it's convert the fibrinogen to fibrin. The fibrinogen is clotting factor 1 and fibrin is clotting factor 1A. And the fibrinogen, that is a soluble form, and fibrin is insoluble form. And at the same time the thrombin that activate the clotting factor 13 into clotting factor 13A. That leads to the formation of stable fibrin clot. This is the extrinsic system. In case of intrinsic system, what happened? Here the clotting factor 12 that is converted into the clotting factor 12A, and then it is converted into the clotting factor 11 into 11A, then 9 into 9A, and 9A along with the clotting factor 8 that convert the clotting factor 10 into 10A. This happens in the intrinsic system, and this intrinsic and extrinsic system that come to a common pathway and leads to the stable fibrin clot. This is the coagulation cascade. But in case of hemophilia, what happened? In case of hemophilia, the two clotting factors of clotting factor 8 and 9, they are deficient or absent. Then what happened? Our coagulation cascade will initiate it, but it's not completed. So there may be profuse bleeding and prolonged clotting time. This happens in case of hemophilia. Then we can discuss about the clinical features or analyze the clinical features based on these pathophysiological changes. What happened during the time of hemophilia? Profuse bleeding. Even in the neonatal period, we can see the bleeding from umbilical stem and bleeding during the circumcision, and also the recurrent spontaneous hemorrhages, usually from ankle, knees, elbow, etc. And it may be the life-threatening bleeding for internal bleeding of GI tract, intracranial space and upper airway. And also there is a mucocutaneous bleeding also be seen. Mucocutaneous bleeding, that easy bruising, excessive or prolonged bleeding, gum bleeds, intramuscular hematoma. Hematomas are more common in case of hemophilia. Then spontaneous hematuria. What do you mean by hematuria? Hematuria is blood in urine. So we can see the spontaneous hematuria and epistaxis, nosebleed. Then hemarthrosis. Hemarthrosis is a typical feature of hemophilia. In hemarthrosis, we can see the bleeding into joint cavity. The common sites are ankle, knee and elbows. Then diagnostic measures. Usually we can use the diagnostic measures blood studies. In blood studies, the platelet count is normal, but we can see the prolonged partial thromboplastin time and clotting time. In our system, the intrinsic pathway uses this coagulation clotting factor like clotting factor 8 and 9. So, the prolonged partial thromboplastin time we can see. Next, we can analyze the clinical features based on this pathophysiological changes. The first clinical features is bleeding. Bleeding from the umbilical stem, bleeding during the circumcision and recurrent spontaneous hemorrhages, usually at ankle, knees, elbow with pain and swelling. And life-threatening bleeding like internal bleeding into the GI tract, intracranial space and upper airway. This also be seen in case of hemophilia. And mucocutaneous bleeding. Mucocutaneous bleeding is easily bruising, excessive and prolonged bleeding after trauma, gum bleeds and intramuscular hematoma. And hematomas are more common in case of hemophilia. And we can see the epistasis, that is nosebleed, and spontaneous hematuria. What do you mean by hematuria? Hematuria means blood in urine. So we can see the spontaneous hematuria and hemarthrosis. Hemarthrosis means bleeding into the joint cavity. This hemarthrosis that is seen in ankle, knees and elbow. In the diagnostic measures are the blood studies. In blood studies, the platelet count become normal, but the prolonged partial thromboplastin time and clotting time we can see. Then specific factor assay, we can measure the clotting factor 8. There are two components in clotting factor 8. Clotting factor 8 have two components. The one component is a coagulant component and one component is antigenic component. Here the coagulant component is deficient. Then we can use the joint X-ray to show the hemarthrosis and neuroimaging like MRI, CT, etc. to detect the intracranial bleeding. And antenatal diagnosis is possible on this case of hemophilia. It can be done in 18 to 20 weeks, that is second trimester of pregnancy. And carrier detection, we already talked about the clotting factor 8, coagulant and antigenic component, and in this case the ratio is become less than 0.6. Usually this ratio is, normal value of this ratio is 1. When it become less than 0.6, that indicate the carrier stage of hemophilia. Then management. The most important management in case of hemophilia, that is control of acute hemorrhagic episode. Then factor replacement therapy, antifibrinolytic therapy and non-factor substitute and local measures. And the first one is factor replacement therapy. In factor replacement therapy, we can administer this purified clotting factor 8 concentrate. And this clotting factor 8 concentrate, that may be plasma derived or recombinant. Usually we prefer the recombinant type because there is low risk of transfusion related infection. Each bag of this concentrate, clotting factor 8 concentrate, they have 200 units. And we can use a formula to calculate the amount of clotting factor required for the infusion. That formula is this, that is we can dictate this clotting factor 8 unit is equal to desired 8 clotting factor 8% into body weight in kilogram into 0.5. This is the formula that we can use to for detect the amount of clotting factor 8. And then we can use the cryoprecipitate. Cryoprecipitate that contains clotting factor 8, but its deficient in clotting factor 9 and 11. And each bag containing 100 units, they carries the risk of volume overload and transfusion related infection. Nowadays, we are used to this type of clotting factor 8 concentrate. And in case of Christmas disease or clotting factor 9 deficiency, what happened? Purified 9 concentrate or prothrombin complex concentrate or fresh frozen plasma, that is administered in case of Christmas disease. And this need transfusion in every 8 to 12 hours. The next is a non-factor substitute. Non-factor substitute, that is a desmopressin acetate. This desmopressin acetate that releases endogenous clotting factor 8 and may be used during the minor surgical procedure. It is never used in case of severe hemophilia A and B. Never use this in case of hemophilia A and B, severe hemophilia A and B. It is only used in case of minor surgical procedure because it releases endogenous clotting factor 8. And the dosage is 0.3 microgram per kg IV in 25 to 50 ml normal saline over infusion, that will be infused over 20 to 30 minutes, or we can administer the nasal spray with 1 or 2 puffs. And the local measures. What may be the local measures? Nothing but the pressure packing bandages and cold compresses. In order to reduce the bleeding, we can use the pressure packing bandages and cold compresses. And in general care, it is a prevention of bleeding where avoidance of physical trauma. We teach the parents and children about the avoidance of physical trauma, especially avoid IM injection. We can give the subcutaneous injection or oral route. Then aspirin advise them to avoid aspirin and good dental care and correction of anemia by the transfusions and prevention of transfusion related infections. This is by screening the blood product and by the vaccinations. And next is the symptomatic therapy. In symptomatic therapy, we can use the bed rest, joint immobilization during the time of acute bleeding. During the time of acute bleeding, we should immobilize the joints. And also cold compresses during the acute hemorrhagosis, and avoid aspirin. Aspirin promote bleeding, so we should avoid aspirin. Then prevention of joint deformity. For preventing the joint deformity, we can use the physiotherapy. Then social and psychological support for the parents and children, and rehabilitation and occupational therapy and genetic counseling. In case of, we can use the antenatal screening test for this hemophilia detection and give the genetic counseling for the parents. And the complication. In complication, the major complication is the chronic arthropathy. Chronic arthropathy is the major complication of hemophilia. Then deformities and disabilities and transfusion related complication and infection. They need frequent transfusions, and that leads to the frequent infections and also the complication, transfusion related complications, especially fluid overload or maybe the infections. And the psychological disorders and development of clotting factor 8 and 9 antibodies. These all are the complications including the hemophilia. Let's come to the nursing diagnosis. In nursing management, our priority of management is the prevention of bleeding. In prevention of bleeding, restrain the child from mastering the motor development. Teach them to avoid contact sports and vigorous games. And the close supervision during the playtime, and immobilize the joint during the acute bleeding. Avoid dental trauma by using toothbrush with soft bristles. This is the acronym we are used to recognize and control the bleeding. That's RICE. R stands for rest, and I for ice, C for compression, and E for elevation. These all are about the nursing management. Now we can discuss about the nursing diagnosis. What are the possible nursing diagnosis for an hemophilic patient or hemophilic children? The first diagnosis is acute pain related to traumatic injury to the muscles. The second one is impaired physical injury related to pain and discomfort with the onset of bleeding episodes. And the third one is compromised family coping related to incorrect and inadequate information or understanding. Then risk for bleeding related to decreased concentration of clotting factors circulated in the blood, especially the factor 8 or factor 9. Then risk of injury related to decreased clotting factor 8 or 9. These are the possible nursing diagnosis for the hemophilia. So, till now, we discuss about the hemophilia, definition of hemophilia, what are the type of hemophilia, how the hemophilia occurs at the pathophysiological changes. We analyze the clinical manifestation based on the pathophysiological changes, and treatment, nursing management of hemophilia. So, you should apply this knowledge in your clinical practice. Thank you.